Hello, welcome to NextMids. If you haven't subscribed to our channel, please hit the subscribe button for daily videos about health, nutrition, and disease-related videos. Labor, also known as childbirth, is the process through which a baby is born from the mother's uterus. It involves a series of physiological and hormonal changes that lead to the expulsion of the baby, placenta, and other membranes from the mother's body. Labor typically occurs at the end of pregnancy, around 40 weeks gestation, although it can happen earlier or later. The symptoms of labor can vary from woman to woman, but there are some common signs that indicate the onset of labor. It's important to remember that not all women will experience all of these symptoms, and some may experience them in a different order or intensity. Here are the typical signs and symptoms of labor. Number 1 is contractions. True labor contractions typically start in the lower back and radiate to the front of the abdomen. They gradually become more regular, intense, and frequent over time. Contractions may initially feel like menstrual cramps or a tightening sensation and then progress to a more distinct and rhythmic pattern. Timing contractions can help determine whether labor has begun. Contractions that occur at regular intervals and become closer together over time are indicative of true labor. Number 2 is water breaking. The rupture of the amniotic sac can occur as a sudden gush of fluid or a slow trickle. This fluid is usually clear and odorless, though it may be tinged with blood or have a slightly yellowish color. If the water breaks, it's essential to notify your healthcare provider, as this indicates that labor has begun or is imminent. Number 3 is bloody show. The expulsion of the mucus plug, which seals the cervix during pregnancy, can result in a discharge that is streaked with blood. This discharge may appear pink, red, or brown and is often a sign that the cervix is dilating and labor is progressing. Number 4 is back ache. Lower back pain or pressure can occur as the baby's head descends into the pelvis and puts pressure on the lower back and pelvic bones. This discomfort may worsen during contractions and may be alleviated by changing positions or applying heat. Number 5 is emotional changes. Emotional changes are common as labor approaches, and feelings of excitement, anticipation, anxiety, or apprehension are normal. It's essential to communicate any concerns or emotions with a partner, family member, or healthcare provider for support and reassurance. Final one is gastrointestinal changes. Hormonal changes and the body's natural response to labor can lead to gastrointestinal symptoms such as nausea, vomiting, diarrhea, or an increase in bowel movements. These symptoms may be associated with the body's preparation for labor and the baby's impending arrival. Monitoring these symptoms can help expectant mothers recognize the onset of labor and seek appropriate medical care and support. If there's uncertainty or concern about whether labor has begun, it's always best to contact a healthcare provider for guidance. Thank you for watching NextMids. Please like and subscribe for daily videos about health, nutrition, and diseases.